my colleagues in the past few years to begin to think about what are all the different factors that we can think about in the decision around how do we navigate these microaggressions that could come up in the clinical encounter and also in supervision. Okay. And before I start, just to tell you a little bit about myself. So I did my bachelor's of psychology at the University of Colorado Boulder. I did my master's and PhD at the University of Wisconsin-Milwaukee, actually where I'm at now. But I left briefly to go to internship and postdoc and started my faculty position at Duke University. But then I got recruited to come back. So I'm back in the Midwest. And my research lab is called the Equity Research Group, where we are really focused on developing psychosocial interventions to address social drivers of health that impact minoritized communities. A lot of our work is with immigrants and refugees, and we're also an implementation science lab. So we work with a lot of community partners to try to think about how they can be implementing prevention interventions and other evidence-based interventions. The work I'll describe today resulted in a series of different papers, but most notably, I want to talk about a chapter that we wrote for a psychiatry textbook, and these are my different collaborators. And so what I'll start with is really briefly talk about definitions and history and typology of microaggressions, but I'm going to keep that very light because I feel like in contrast to many years ago when this work started, we've been talking so much about microaggressions that my sense is that you probably have already had presentations on this topic or you are, aware of the literature. So I'll keep that light. I'll share with you a framework that we developed in terms of thinking about the kinds of strategies that we can use to address microaggressions. And then we will consider a vignette that will allow us to think through what this could actually look like, both in the clinical encounter and in supervision. And hopefully we'll have some time for additional questions. So let's dive in with the definition here. So the first thing that I want to note is that prejudice is not the same as stereotyping, and it's not the same as implicit bias, and it's not the same as microaggressions, and it's not the same as discrimination. Okay, so these are all interrelated concepts, but they are all different. And when we're talking about prejudice, stereotyping, and implicit bias, we're often referring to attitudes. And sometimes these are not conscious. But when we're talking about microaggressions and discrimination, we're referring to behavior. And so prejudice is a preconceived opinion that is not based on reason or actual experience. So for example, in the 1970s, Haldol, which is an antipsychotic, came out with an advertisement. And what they did is they depicted a Black man, it seems, and they used words like aggressive, assaultive behavior, right? So these sort of connotations that made clinicians have an implicit bias related to the kinds of patients that would be good for this medication. And then what we saw around that time was an overdiagnosis of Black individuals, specifically Black men with psychotic disorders. Okay. A stereotype is a widely held but fixed and oversimplified image or idea of a particular type of person or thing. So in our field, we often have courses, like multicultural psychology or even textbooks that try to help us to think about how we can offer care that is culturally attuned and appropriate and relevant and all these things, right? But inadvertently, sometimes that perpetuates stereotypes about different cultural groups, which is a reason why I don't love multicultural psychology training that focuses only on group differences, because I think that it doesn't go far enough to really help us think about nuances and heterogeneity and thinking about it as hypotheses that then we can figure out whether it fits or it doesn't fit. Often this literature sort of makes one size fits all statements about groups, okay? And then when we're talking about bias, these are mental processes that then have bearing on discrimination. So if we think about explicit bias, these are things that we know, they are consciously endorsed. Right? And so if they are conscious, then we have the intention to act and we're aware that we're acting in that sense, right? But when we're thinking about implicit bias, individuals may not always be aware that they hold that perspective, right? And so it might be that they are not intentionally trying to be hurtful towards a particular group, but that is still there anyways, right? So we can talk about intent versus impact, and we will in just a moment. Okay. So an example that I saw when I was going through my training here was that this idea of clinicians being less likely to prescribe pain management medications to Black patients because of the implicit assumption that they might be drug seeking. Okay. Or, whoops, or assuming a child's academic struggles are due to their bilingualism rather than really exploring potential systemic or emotional factors that might be going on. Okay. And so then that brings us to discrimination. So that has to do with the unjust or prejudicial treatment of different categories of people or things, especially on the grounds of race, age, or sex. And so this would be like a higher likelihood for a Black person living with severe mental illness to be physically restrained by police and hospital staff, or a school psychologist disproportionately referring Black or Latino students for special education evaluations based on perceived behavioral issues while overlooking similar behaviors in white students. And so the point here is that when we have strong negative emotions, we have prejudice and we have stereotypes, those are the conditions for discrimination. But when we have implicit bias and prejudice and stereotypes, that's where we have microaggressions. We have all probably engaged in microaggressions to one extent or another. I mean, we're all human. I certainly have, right? And the thing about it is that sometimes we're not aware of the impact that we're having, right? It's not often a intentional thing that I'm trying to do to hurt someone, okay? So that's where the implicit bias comes in here, okay? So in the 1970s, this term was coined by Chester Pierce, and he described microaggressions as subtle, stunning, often automatic, and nonverbal exchanges, which are put downs. And since that time, really in the 2000s, Dr. Daryl Wing-Sue really began to revive this research. And he has written some of the most seminal pieces in this area. And he describes racial microaggressions as brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative racial slights or insults towards people of color. So he really, really focused on racial microaggressions. And since that time, lots of different researchers have focused on different types of microaggressions for different groups. For example, LGBTQ plus individuals, immigrants and refugees, so on and so forth. We also know that microaggressions can range from being subtle or ambiguous or implicit, something like a micro-invalidation, all the way up to being egregious and blatantly explicit behavior. So those are the kind of things that Dr. Sue would call micro-insults or micro-assaults. Okay. So imagine you are the therapist here in a session and client says, wow, your English is really good. Where are you from? I mean, where did you study? Right? So they sort of correct themselves, right? And you can just sort of pick up that there is sort of a hidden meaning of you're not from here, right? You don't belong here. Okay. And so again, coming back to this idea of intent is not always impact, right? And so just to normalize this, we have all likely been perpetrators of microaggressions such as this one. And oftentimes we're unaware of the impact that we're having. And so as we're sort of wrapping up here, this sort of foundational piece, I do want to share with you a few pieces that I have found really important. Feel free to take a screenshot of this if you want to do a little bit more reading. But I'll just highlight that the work by Dr. Sue has been really sort of the seminal pieces in this area. And in 2010, they developed a book that is a really good resource. But if you want something a little bit shorter, these two articles are really helpful. Okay. All right. So let me share with you a framework so that we can think about how to begin to address microaggressions. And so when we're thinking about microaggressions that can happen in the clinical encounter, they can occur for a range of different reasons, right? A lot of times it has to do with our personal identities, such as our race, our ethnicity, our country of origin, our immigration status. It can also be due to our physical appearance or ability status. It can be due to our gender identity, our sexual orientation. Um, it can also be due to your age or your level of training or your rank. And this is really common when we're in training, right? When we're just starting out as clinicians. Sometimes you might hear things like, wow, you look really young. Are you really my therapist? Right? And we can say, okay, that was probably a microaggressive statement. Um, we can also see that this happens because of discipline or even the institutions that we go to, and sometimes even our theoretical orientation. And this can happen between colleagues as well, especially if you are working in a diverse setting. Okay. And so microaggressions are commonplace and they can happen trainees to their patients. It can happen the patient to the trainee. It can happen trainee to trainee. It can happen supervisor to trainee, right? So it can happen in lots of different directions, okay? And so when they occur, we are often left feeling a range of different things. And I can imagine that if someone said to me, like, wow, your English is really good. Like, where did you study? I might have initial thought of like, oh, did they really just say that? Like, what the heck do I do at this moment? How do I respond to that? Right? Because it kind of just takes you a moment to think about what you want to do. And so the first thing that we have to consider is why would we acknowledge that a microaggression happened, right? Especially if it's a really sort of delicate psychotherapeutic situation. And I would argue that microaggressions at times can represent therapy interfering behaviors, right? But at times they can even represent therapy destroying behaviors. Okay. And so they could really cause the therapeutic relationship to be so broken that it just might not be able to be repaired. And so we really need to be able to address if possible. Okay. And the other thing is, if there are ongoing microaggressions that are happening, either a clinician is being microaggressive towards their patient or the patient towards the clinician, that can begin to wear down the therapeutic relationship. And that can then have impact on the client outcomes. And so this becomes really important for us to be paying attention to when these things are happening. Okay. But they are complex and they're not straightforward. And sometimes they can be really, really confusing to know what to do with it, right? And so when you are deciding if or how or when to address a microaggression, there are lots of different factors that we often consider. The first has to do with the presence of a microaggression. So, was that actually a microaggression? Did they really just say that? Did I misunderstand? Did I mishear what happened? Or is that really what just took place? Okay. The second has to do with the level of emotional arousal. So, is the client completely dysregulated? Are they in a state where they can have a conversation about the fact that a microaggression just happened, right? Or even on your side as the therapist, do you feel like your emotional arousal is really high where you might have a hard time having an effective conversation? Because that certainly happens, right? We also have to think about timing. So, do they say it as you're walking out of the therapy room, and you're going into the hall, and now the therapy session is done? Like, do I respond then? Do I wait for the next session? Do I just sort of let that go? And then we also have to think about where in the treatment are we? Is this my first session with the client? Or do I have some relationship to burn? Have we maybe built up our relationship with one another where we could withstand having a difficult conversation? Which again brings us to this next point here around how strong is our therapeutic relationship? How much rapport have we already built? And then I also think about the intended function and what was the intent, okay? So sometimes a microaggression could have a communication function, okay? Sometimes it could have the function of actually trying to be harmful. Sometimes they may not know that they're using a word incorrectly, and so there was no ill intent at all, right? And so that is something that we have to consider as well. Um, Sometimes then we have to think about who is the recipient because you might hear a microaggression that might be about somebody else. You're not the direct recipient. And then you're left with this question around, do I say something? Should I say something? What is my role? How do I navigate that? Okay. I also have to think about the frequency of microaggressions. So is this something that is happening every single session, right? Are they just repeatedly saying this over and over? Are we having this kind of an issue repeatedly? Or is this sort of a one-off instance and we can sort of assume that, it was not sort of a larger intentional sort of a behavior? Um, then, if we're thinking about to address it, we have to think about how would addressing it actually fit with the treatment targets. So, for example, if a client has a treatment target of wanting to have more social support and having more people in their lives who they're connected to, and they keep saying really offensive things, especially if they don't know that they're saying really offensive things, it might become a really important piece of the therapeutic work to give them some feedback, right, about their interpersonal style. Okay. On the other hand, if they're saying microaggressions and what they're coming for is insomnia and you're trying to get them to sleep better, then you might have some more thoughts around, does it make sense for me to bring this up or not? And how do I do that in a way that doesn't pull us away from the central focus of our work together? Okay. Which also brings us to the next point, which is, are there other targets in the session? So for example, microaggression happens, but suicidality is also on the table. Which one am I going to address? I would say that almost in all situations, I'm going to focus on the suicidality first, right? And that's going to take precedent over whether we need to address this microaggression. And you also have to think about the danger in the room. If someone is really dysregulated, if they have a history of being aggressive towards you or other people, it may not be safe for you to bring up a microaggression, right? And so you really have to consider your safety in the moment as well. Okay. Whew, I'm halfway through my list, y'all. I'm going to keep going here. Okay. You can see how complex this is, right? There's lots of different factors. Then we have to think about how has the patient responded in the past? So have you had these kind of conversations before and how did it go? If it was an effective conversation and the client could see where you were coming from and it was a learning opportunity, maybe it's actually very valuable for you to give them feedback about the microaggression. If instead they got really upset, really dysregulated, they barged out of the room, something else happened, maybe we're not in a place where we can go there yet. Okay. Um, I've also been in settings where there wasn't a lot of organizational support to back up clinicians when these microaggressions happened. And so you also have to consider if you take a risk and you address something, are you going to have the support of your supervisors, the attending psychologists, and other people to make sure that you are really feeling safe in doing so? Okay, so that becomes important. You must also think about your own level of burnout and your capacity and your willingness to address this. We are in unprecedented times where we are experiencing a lot of different stressors. And I just want to state here that it is okay if the thing that you can do in that moment is to say like, you know what, today in this moment, this might not be the best time for us to have a conversation about this. And I'm going to see if this behavior comes up in the future. And if it does, maybe at that point we can have a conversation about it. Okay. You might also think about the client's familiarity with that concept of microaggression because that is going to influence whether I even use the word microaggression, right? So if I'm working with a child client, I probably would not say microaggression, right? And so you really want to think about how you would talk about this, okay? Sometimes the microaggressions are going to be really ambiguous, right? And so you might really be left thinking like, I'm not sure if I actually understood what they just said. Um, on the other hand, sometimes it's so in your face and so egregious that you have no choice but to do something about it. Okay. And then if you have minoritized identities, or even if you're the target of the microaggression, I think we also have to consider, is it your burden to educate other people about your group and your experiences, right? I also want to note here that um, it's okay to also take a rest, right? Especially if you are someone who has been experiencing a lot of different microaggressions, because that can be exhausting. Okay. So I want to give you this list. I know that was very, very long, but just to highlight that it's not a straightforward, like if a microaggression occurs, yes, say something, right? There's lots of different factors that we have to consider. Okay. And so when we do that, we have to think about how we would actually address this. So I'll talk at a high level about these different tips, and then I'll go into a little bit more detail. The first thing is we, as the clinicians, have to be able to inform ourselves about microaggressions, what they are, the different kinds, so that we can be aware of when they happen and so that we can be exploring them when they do happen. If we're going to address it, we have to acknowledge that it happened. And then we have to determine the optimal time for intervening on the microaggression. We also want to stop the microaggression from continuing in the moment. And we want to explore the nature of the microaggression, the intent, and the impact. We want to be able to describe the impact of the microaggression to that perpetrator, whoever did it. And we want to develop a plan for repair. And then afterwards, we want to secure support and build up our skills to be able to navigate these sorts of situations in the future. So how do we do that? Let's delve a little bit deeply into that. Okay. So what I have here is a series of headings here. The first is our strategic goal. So this is what the individual is hoping to accomplish. Then we have the objective. So these are specific, tangible, and measurable aspects of the goal. We have the rationale. So this is the why we want to accomplish that goal. And the tactic is the how we're going to accomplish that goal. Okay, so in this case, we want to be able to inform ourselves to identify microaggressions and foster safe environments where microaggressions can be explored. So how do we do this? Well, being here is one of those things. You are increasing your knowledge of microaggressions, right? And I would say that supervisors and administrators also need to be really attunely aware about this, because it is their responsibility to also advocate for you and to also support you in these situations, okay? Especially if they have more relative power, okay? Okay. Then we want to acknowledge the microaggression happening. Now, we can acknowledge it internally, right? We don't necessarily have to acknowledge it out loud, but we can just sort of say, like, okay, That was a microaggression that happened, okay? And so the tactic here is for us to be prepared to recognize when that microaggression transpired and to label it as such, okay? And so here's an example. The mental health clinician thinks to themselves, my patient just said that they don't see color when they're working with me, and I'm a person of color. That's definitely a microaggression, okay? Then we have to determine the optimal time for intervening. And this is where we consider that big list of things that we just spent some time on, because you may decide that, you know what, this session may not be the time for us to go into this, but maybe at the beginning of the next session, we need to revisit this. Or maybe it is such a large thing that happened, such a big rupture that you can't ignore the elephant in the room. Okay, so you have to really consider whether it makes sense. Okay, but you also want to give yourself enough time to have that conversation. And so, if there's only a couple of minutes left in the session, you might begin, but then let them know that you're going to talk about it next week, or you might altogether decide, hey, let's have that conversation next time. Okay. This also becomes really important if a situation is unfolding and the client is continuing to say really, really offensive things, especially if it's towards you. You want to be able to stop that microaggression from continuing in the moment. Okay. And so, what we want to do is to communicate disapproval non-verbally, right? So, you might make a confused look of like, okay, wait a minute, right? I often do this, like when I need a timeout or like, wait, right? We're gonna pause right there, right? Or like, you can also do this verbally and say, okay, can we just take a moment? I just need to acknowledge what just happened, okay? Um, and so then that can open the door for us to explore the nature, the intent, and the impact of the microaggression, okay? What we're trying to do here is to not come a place of being really punishing, right? What we're trying to do is to lean in with understanding, with openness, and a non judgmental stance. And we want to ask more clarifying questions so that we can understand the nature of the microaggression. Okay. And so I might say something like, I'm not sure what you mean. Can you repeat what you just said? Right. Or I don't think I caught that. What did you just say, or what did you mean when you said this? Right? That allows people to take a step back and maybe say like, "Ooh, I said that, but what I meant to say was this," or for them to say it again so that you can really have some clarity around the fact that, okay, that is the thing that I heard. Okay. And then it's our goal to describe the impact of that microaggression if we deem it to be a microaggression. And so, what we want to do here is we want to stick to very behavioral terms. Okay. I want to just describe the behavior. I don't want to make value judgments about the person. I don't want to shame them. I don't want to punish them. I just want to say something like, okay, a moment ago you said X to describe Y. Okay, so I'm just giving you back what I am perceiving. Okay. And then you can go a little bit further. So you could say something like, so when you said X, it made me think that you meant this. And that generated a lot of confusion for me. And I'm just wondering if we could slow down for a moment and have a conversation about what you meant and what are the implications of what you just said, right? Okay. Um, if you're engaging in that conversation and the client understands where you're coming from, or at least has some willingness to entertain this conversation, eventually it might be helpful for you to get to a point in the conversation where you can develop a plan for repair. Okay. And we can think about who the repair has to happen with. Okay. So, for example, I have been the group therapist in a DBT skills group, and one of the group members said something really offensive toward me in the middle of the group. Okay. So the group setting is not the place where we're going to necessarily have a conversation about what just happened, even though everyone witnessed it. But afterwards, I might pull that person off to the side and say, listen, you said this thing to me, and we need to have a conversation about that because it wasn't okay. Okay. So let's really explore this and come up with a plan for repair. Um, and often the plan for repair is acknowledgement that the microaggression happened and apology that it had the impact, not the intent. So I'm being really careful about that. Often we say, "Oh no, but I didn't mean to say that to you," right? I didn't mean that. That is not as important as the actual impact, right, that it had. Okay. Okay. And so sometimes you might say something like, so it would be helpful for me if you could say something that indicates that you understand my perspective, even if my perspective is different than yours. Okay. That's really sort of encouraging the client to communicate to you that they see where you're coming from and then what to do about it. Okay. And of course, these situations can be really stressful and uncomfortable, right? And so we might need some support afterwards, okay? And so this can look like going to consultation and bringing this up to peers and other supervisors. It can look like going to your direct supervisor, having a conversation. It might also be that you need personal space. Maybe you need to go for a walk, right? Maybe you need to do some mindfulness or something else because it was really, really impactful. Okay. All right. And lastly, here, this is an evolving field. And again, our sociopolitical climate is getting more and more complex all the time. And so we need to be able to build up our skills to address microaggressions that could be happening in the future. And so it's helpful, even if this is not already happening with your clients, for you to talk with supervisors about it and have a plan. So if this were to happen, what would be the best course of action, right? So that if it does happen, you already have some skills under your belt in terms of how to navigate it. Okay. Okay. So a note on how we can seek some care for ourselves. It is totally appropriate for you to go to a consultation team and to seek validation from others. Okay. And you can be direct about that. And the same thing with your supervisors. Um, you can also go to a consultation team to help check the facts regarding that microaggression. So maybe you're confused about a word that a client used or even what they meant, right? Maybe others have heard about that and they can also provide some insights about it. Um, you can also bring it up to a supervisor or an administrator if you need organizational support, right? So if a policy needs to be created at the institution, then that's the kind of thing where you should hopefully be asking people who have more relative power to be advocating for that policy to be created. Again, practicing resiliency building skills, so things like emotion regulation skills, mindfulness skills, that sort of thing. And then you're also within your right to provide feedback to bosses and decision makers for the goal of enforcing guidelines and rules about how to address microaggressions. So, for example, if you're noticing that microaggressions are happening and no one is stopping them, it might be helpful for you to bring this up to someone and say, look, I'm noticing that this pattern is happening. What can we do about it so that we can make sure that we're all on the same page about how to navigate this? Okay. Okay. Um, and if you do decide that you want to address a microaggression, I have a couple of tips here. You have to remember that balance is important. We have to acknowledge that microaggressions are often unintentional, but we also have to provide feedback about the impact of the comments. Okay. And that we have to remember as clinicians that effective communication is often facilitated by leaning in with understanding and with openness and trying to understand the perspective of the other, even if they're saying something really offensive towards you or somebody else. Okay. And so we want to be able to validate what is valid in what they're communicating, or even the emotions or the intention. And we want to highlight the impact of the microaggression. We don't want to use language that is counterproductive or iatrogenic. I mean, probably, if someone said something racist to me in a session, I might not jump to saying, "Oh my God, you're such a racist," right? Like that would probably not go over well. And they're my client. So that would just not be therapeutically useful. So I have to think about what kind of words am I going to use to make sure that we can have an effective conversation. Okay. And then we can also think about what level of self-involved self-disclosure could also be relevant. So when I talk about self-involved self-disclosure, that is self-disclosure about me and how I'm feeling. So for example, if someone says something that is a racial slur towards me, which is what happened in that group setting, it is within my limits, right? Everyone's limits are different, but it would be within my limits to tell the client, hey, when you use this word, that is similar to other times in my life when other people have used that as a slur towards me because of my identities, right? So you can decide what degree of self-disclosure would feel relevant and appropriate for that situation. Okay. And as we're talking about the things to do, we should also talk about the things not to do. So I tend to think about these in two different buckets. So we have the behavioral deficits. This is where we are being avoidant or we choose to not bring it up, especially if it keeps happening. And now it's been so awkward. I didn't address it the first time. I can't bring it up now. And it just keeps evolving and evolving. And it just snowballs into a really large situation. Okay. The second thing would be around rationalizing, dismissing, or denying the behavior and saying things like, oh, yeah, they said that, but I know they didn't mean it, so it's not that big of a deal, right? If that's my go-to response every single time, I might have to consider what that's about. Okay. Um, or allowing frequent and recurring microaggressions to persist in the treatment without being addressed. Okay. On the other side, we also don't want to have behavioral excess. We don't want to be defensive. We don't want to strike back. You also don't want to be venting and ruminating out loud in inappropriate ways with your colleagues by the water cooler, right? You can bring it up to consultation. You can bring it up to supervision, right? That is a really effective way for you to talk through what happened. But chatting about it with other colleagues at a bar or a coffee shop is probably not the most effective. Okay. And we want to be mindful in the moment to not be overly emphasizing our own emotions, right? This, at the end of the day, is still treatment. And we have to be really thinking about the client and their treatment targets and what is the reason that they have come here for. Okay. Okay, let me pause here before our vignette and open the floor for any questions or reactions that you might have about anything that I've talked about so far. Even if the reaction is, I've heard this before, or this makes sense, or I'm with you. Any thoughts here? Clarifying questions.
I just want to say that I think this is really important and I appreciate this conversation, this discussion a lot. So thank you.
Thanks, Christina. I really appreciate that feedback. Thanks. Okay, so let's consider a vignette, and I want us to really think through all the different layers here and how we might navigate this, okay? So this is the case of Max, and as we go through here, feel free to jot anything down that you would like in terms of the types of microaggressions that you notice, maybe the identities that are getting microaggressed toward, what clinically relevant factors you would consider in your decision to either address or not, and how. Maybe whether there are missed opportunities to address or what you might have done in this situation. Okay. Okay, so here's the context. So Max is a 9-year-old client and has been referred to therapy due to difficulties with anxiety, frustration tolerance, and peer relationships. And during today's session, Max is recounting an incident at school involving a disagreement with a classmate. As his frustration escalates, Max uses problematic language that raises a concern for the therapist. Okay, so Max says, I was just so mad. He always messes things up. He never knows what he's doing, and he's just so retarded. Seriously, it's like he can't even think. Everyone gets annoyed with him. And also, he can't even speak English, so we can't understand what he's saying half the time. He shouldn't even be in our class. Therapist says, Max, I can tell you're really upset with your classmate, and it sounds like it's a frustrating situation for you. But I also want us to pause and think about the words that you're using to describe him. I wasn't trying to be mean. I'm just saying the truth. He's different, and no one even understands him because he doesn't talk like the rest of us. It's not my fault if he makes everything's harder for everyone. I hear you, Max, and I know that you don't mean to be hurtful. But sometimes, even when we don't mean to be, our words can hurt other people or make them feel left out. When we say things like that, we're making assumptions about why someone else might be struggling, and those assumptions may not always be true or fair. I'm just so tired of adults trying to tell me what to do. My parents do it all the time, and now you're doing it too. No one ever cares about how I feel. Then the therapist has supervision, okay? And here they are trying to describe to their supervisor that they felt uncomfortable and unsure about how to navigate the situation. And the student is trying to seek from their supervisor feedback about how to navigate the situation and support for how to navigate future situations should this come up again. And supervisor says, honestly, I wouldn't spend too much time worrying about minor things like that. In the grand scheme of things, the kid has more significant issues to focus on. So what if they occasionally say something that isn't politically correct? These days, it seems like you can't say anything without everyone getting up in arms about it. Okay. Whew. Let's pause there for a moment. So, a couple of reflections, and this is where I really want to encourage you to maybe go on camera and let's have a conversation here. So, just a few reflection questions for you. So, what microaggressions did you notice, both in the psychotherapy session and in the supervision meeting? And what factors do you think that you might consider in terms of if, how, and when you would intervene? And then how might you approach a situation with Max? And how might you navigate the supervisory relationship? So let me go stop sharing here so we can see each other. And I will open the floor here for any reactions or thoughts on this vignette.
Hi, my name's Elena. I'm just gonna jump in. Can everyone hear me okay?
Mhm.
Cool, amazing. I never know with my internet quality. My brain was going mostly towards, I think, question two with like if, how, when to intervene. And what comes to mind is the point that the supervisor made about like, oh, is this really that important in the grand scheme of things? And I think that given the peer challenges goal is that Max is having, I do think that it is potentially very therapeutically relevant, regardless of whether or not like the therapist needs to address it for their own like providing of quality care needs. Um, and I also think that maybe timing wise, first, like the therapist could have focused on validating and processing Max's like emotional reaction. And then once he was in more of like an emotionally regulated state, whether that session or like a different session down the line, especially if it was like a pattern of behavior that could be driving to your concerns. I think like creating space in a way that really focuses on like not making Max feel like adults are always telling him that he's doing things wrong. But like, yeah, and being very like present of that like reaction that Max has, because like then you're going to end up having like three different conversations because Max is continuously like changing the topic on you. So yeah, those are some of my initial thoughts.
Thank you, Elena. Had some really, really wonderful thoughts there. So I love that you're thinking about what are the treatment targets here, right? And so the fact that peer relationships is really important to Max sort of indicates that this is an important thing to stop and like, let's really talk about what's going on here, right? And it just raises a lot of more questions. See, I think in that situation, you would want to just lean in with a lot of curiosity and just get more context for what's happening and are these things that you're saying who did you hear that from like what is the reaction, that kind of stuff. So I really appreciate all the points that you brought up. Thank you. Other reactions? Or maybe questions that you might ask or things that you might sort of consider doing in that situation.
This is just an answer to the first question about like what microaggressions were being done. Just like a broad answer, but I think like there's a very obvious one of like not speaking English, and so that's like an ethnic racial microaggression. But then there's also another microaggression using the R word that I think sometimes can be glossed over when there's one that might be more overt in a way, depending on your background and experience. But I think that the R word is especially salient, especially with like kids that age and adolescents like still using that in the world now, and being able to address that in a way that makes sense for both you as the clinician and your like feelings and experiences, as well as the client and especially in our program, children and adolescents, in a way that they can understand and digest.
Yeah, I love that you are having this sort of intersectional perspective, right? Because in this situation, there does seem to be something about there is sort of like this person is an outsider, they're not from here, they're not like the rest of us, right? And then there's this other element of sort of talking about ability status, and both are equally offensive. And so it's a question around, do you address both? Which one do I address first? How do I talk about both of those things at the same time, right? So thank you for bringing that. What do you make of the supervisor's dismissal? How do you think you might navigate this in supervision? Or even a different scenario, right? Where you might sort of bring something up to a supervisor about microaggression and they either don't get it or they dismiss it or just sort of move on to other things. Because that can be really challenging in the context of being a trainee, right?
Um, I wonder if it might be appropriate in like that case or scenario to further ask a little bit, like maybe why they think that is, or like why it might not be as
Mhm.
big in the grand scheme of things, just to maybe understand and just like like continue the conversation that way by like asking a couple more questions.
Yeah. I love that. I think I would do something similar, which is that sometimes by feigning confusion, you actually can have a really effective conversation for the person to understand like why what they said, right, could be, offensive, right? And so sometimes you could say something like, okay, it's just that, my sense is that when clients say this and this and this, it means this. So I just want to hear where you're coming from and why you don't think that that is an issue. And can we have a conversation? I really just want to hear where you're coming from. That then allows the person to sort of take a moment back and be like, okay, let me reflect on that. What is going on here? And can actually be effective without getting the supervisor in a very defensive space, right? And thank you for sharing that. Cool. Any other thoughts or questions that you're having about this topic or the scenario?
I guess I had a question about how to approach this topic with parents, because a lot of the times when we're working with children, we're also working with the parents. And like obviously there are limits to confidentiality, and it doesn't feel like this might be one of them if they ask, if the child like asks us not to tell the parent or something. But also just like, yeah, navigating both parties in the situation, because I would assume maybe the parent would also have some sort of reaction to, what you share with them about the microaggression that was said, and almost either, I mean, could take it a bunch of different ways, but yeah, just kind of balancing out the parent and the child as like both of your clients.
Mhm. Yeah, it's a good question. I think I would encourage you to reflect on what would be the function of telling the parent, right? Um, you know, often we are letting them know when there's something that's putting the child at risk, right? Or when they need to be involved in a certain part of treatment. In a statement like this, especially because Max is saying like, no one ever listens to me, everyone always tells me what to do, I might think like, hey, this might be a conversation that I can just have with Max, right? About the words that he is using. Um, and if it escalates, maybe that's a time where it would be useful to bring in the parents. But in the first scenario with that one-off statement, maybe not. So I think the highest sort of order question I would have is like, what would I be hoping to achieve by telling the parents? Thank you.
Thank you. That makes total sense. Yeah, like the function, thinking more about like the function of
Right,
disclosing that information.
right. Now, it's also possible that the place where Max heard it was the parents. Like maybe Max doesn't actually know what Max is saying, and uh, they're just repeating what they're hearing at home. And so in that case, it might be important to have a conversation with the parents, right? About the microaggression and the impact and what they want to do related to that, which certainly makes it much trickier, right? Good question. Thanks. Right, folks. I know we're getting close to the end of time here, but are there any other comments, questions, thoughts? Okay. Well, thank you so much for your time. In case you have any questions, let me just sort of sorry, share my screen again. Let me come back here. In case you do have any questions, this is my email, and you can feel free to contact me. Thank you. Stop sharing that.
Thank you for a terrific and really practical presentation.
You're very welcome. Thank you for the invitation.